Good afternoon, everyone. Alisa, Haushalter, Director of the Shelby County Health Department. And on behalf of the Joint Task Force, I want to welcome you to our Thursday update. We have a special announcement today and also a special guest. So I'm going to give our data updates, talk a little bit about the vaccine numbers as we have them today. Then I'm going to turn it over to Dr. Martin, who's going to talk more about the vaccination process locally. And then we have Dr. Tracy Hall with Southwest Community College. It's going to talk about a partnership that we have with Southwest to open a site in Whitehaven. Then Dr. Randolph will do the concluding statements for us, and then we'll open it up for questions and answers. So as of today, we have 81,657 cases. That's an increase of 446 cases in a 24-hour period. So at this point, our numbers are really staying steady, and that's positive. Our reproductive rate is down to 0.8, and so much less than 1, and we're very excited about that. We are continuing to do contact tracing. We're very closely working with the labs to monitor for any variants locally so that we can do rapid contact tracing and isolation and quarantine if we get any of the variant strains locally. We're also focusing very heavily on enforcement. And I just want to bring up the fact that I know from the reports that I received, we're getting a lot more complaints about businesses as well as community facilities of different sorts, not limited to restaurants. So I want to remind everybody of the importance of adhering to the health directive, because we will continue to focus on enforcement moving forward. But the majority of efforts locally are focused on vaccine and getting the vaccine out to our community. So I wanted to share a few numbers from tennis. And just as a reminder, that's the state database that records all immunization data. What we had in tennis as of 5 o'clock yesterday is that in Shelby County there have been 50,094 doses administered. 37,838 of those have been first doses, and 12,256 are second doses, or that means people have completed both doses, so they're fully vaccinated. Yesterday, the Pipkin site was operational throughout the day, and also the Appling site, which is a partnership with the City of Memphis, University Clinical Health at UT, and the Health Department, also operated all day yesterday. And between both sites, there were a little bit over 2,500 doses given. At Pipkin, they were first doses, and at Appling, they were second doses, so that's positive. And then we also are providing vaccine at our commodity foods property on Bellevue, and very pleased to say that we had 153 seniors who were vaccinated yesterday at that site. And that, or on Tuesday, I apologize. So we will be vaccinating there on Tuesdays and Thursdays. So I'm going to turn it over to Dr. Martin for a little more detail on vaccine, and then we'll talk about our Whitehaven site. Thank you.
Good afternoon. Good afternoon, Dr. Judy Martin. It's my pleasure to share with you a little bit the specifics on the Shelby County Health Department numbers in terms of this the vaccine effort. As we listen to the numbers in terms of the total number of first doses administered in Shelby County, I'm really pleased to say that the majority of those, well, more than half of those doses have been administered by the Health Department. That just makes us feel good because we know that we put a lot of effort in, as they have as well, but with most of our effort being in the community. At this time, we have served 18,799 Shelby County citizens that presented for vaccines in Shelby County with COVID vaccine dose number 1, 18,799. At this point, we have reached the time that it's that people should begin receiving the second doses, and we have begun that. We began that yesterday at one center, and with that, on the first day, 1,435 doses were administered. So that puts us in a good place in terms of, we know we have a long way to go, but we started out with a good trot, and we're picking up the speed as we move along. The first doses will continue to be administered over the course of the next few months in order to adequately cover this community. And then the second doses will be announced as we plan those events to administer that vaccine as well. Again, individuals that receive Moderna as their first dose will continue to receive Moderna as their second dose. The same thing for Pfizer. If an individual receives Pfizer as their first dose vaccine, they will receive Pfizer for their second dose as well. The current locations, Dr. Haushalter already mentioned that the Pipkin Building, which serves as our base, that's fully operational 5 days a week. But another location is at the Commodity Center. Services are provided there to commodities or CSFP eligible residents 2 days a week, on Tuesdays and Thursdays, during the hours that center is operating. There are a number of other locations that will be opening in the very near future. Just remember our focus on equity and access, and for that reason we are looking at special population groups, including poverty, those that are homeless, those with special developmental, different kinds of needs, the elderly, underserved. And so just remember that we do have a major focus on those areas. We do plan to, in the very near future, open a location in the Whitehaven area. A number of conversations have been held and negotiations are underway, trying to reach a point of closure regarding those agreements, as well as in some other communities. And I won't go into the detail, but I do want everyone to know that all of the municipalities have been coming forward, expressing interest in providing space, facilities, so that services can be provided across the county of Shelby, which is a good thing. We're all in it together. I will mention that the second dose locations have been announced to the public. The first location that began operating was the Appling Center, and they began operating this week. They will operate this week only, and they're very busy. And next week, the two locations that will operate are at the Pipkin Center as well as the Germantown Baptist Church. And we're very excited about that, and we are, again, moving forward. We're continuing to schedule activities, schedule opportunities for individuals to receive their first dose all along the way. At this time,
If you'll make a more formal announcement about the partnership with Southwest, and then turn over.
Okay. Dr. Haushalter asked if I would go ahead and speak a little bit in more detail regarding the formal partnership that is underway with Southwest Tennessee Community College. We are very excited about that partnership. And the Shelby County government leadership and the attorneys have been working very closely with Southwest Tennessee and their leadership and legal department to come to a formal agreement in terms of how we can continue to expand our reach into the community. And it's a beautiful thing that those community colleges are located within the communities of need. And so that will also improve access. We have now, my understanding is that all of the MOUs have been signed off on, and that we are in agreement, and that we are now preparing to launch an opening at the the Whitehaven branch of Southwest on next week. And so we're really pleased about that. I think I'll stop there, and I'll be willing to answer any questions as presented at a later point. At this time, I'd like to introduce Dr. Tracy Hall. Thank you.
Thank you very much. We appreciate Mayor Lee Harris, his leadership in this effort and throughout our community's pandemic response. And we commend and truly appreciate Dr. Haushalter, Dr. Randolph, and all of the dedicated men and women of the Shelby County Health Department who work on the front lines of this pandemic each and every day. The COVID vaccine is a light at the end of a very dark tunnel. Southwest is proud to partner with Shelby County government to help deliver the vaccine to Shelby County residents. Our Whitehaven Center is an excellent location for this project. It's a familiar, welcoming location of higher learning, and it's conveniently located in a well-known Memphis neighborhood, and it's easily accessible. Our Southwest nationally award-winning security will be there to provide all of the safety precautions so that everyone can know that they're safe at our location, and we will support the health department's efforts to deliver the vaccine to as many residents as possible. Southwest is the community's college, and so efforts like this is what we do. This is Southwest, and we are pleased to partner to make sure that everyone in our community is served. So thank you again to Mayor Harris for this opportunity, and to Dr. Haushalter and her staff for the life-saving work that they do each and every day. Now, Dr. Haushalter.
Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for the Shelby County Health Department. I just want to spend a few moments reiterating the importance of everyone staying the course. As you well may be aware, that our numbers are improving. There's downward trends in positivity, downward trends in the number of new cases over the past 14 days. And so we're making progress. And so I just want to encourage everyone, please continue to exercise individual personal responsibility and adhere to the safety measures outlined in the Health Directive number 17. Everyone should have a copy of it that you can use as your guidance as how you go about your daily activities as individuals. I encourage you to continue to wear your mask, continue to practice your social distancing, continue to avoid crowds and gatherings, get tested. Also, if you test positive, isolate for 10 days. If you are exposed, quarantine for 10 days. And when the opportunity presents itself, get vaccinated. I really want to encourage people, especially if you're 65 and older, have some comorbidities. If you enter an establishment that's overcrowded, people are not wearing masks, don't go. Just because something is open doesn't mean that you should go into it. You know your personal health status and situation. Don't take the risk. Young people, if you're out hanging out, you're under the age of 40, and you're in crowded situations where people have not been wearing masks, you need to consider yourself likely to be infected. Therefore, you should go get tested. And also, you should isolate, quarantine yourself, especially away from family members and others who may be vulnerable. So I really want to encourage you to, as an individual, to adhere to the safety measures. But I also want to speak to the services and business establishments. You have a responsibility as well. One thing I do want to make clear, especially as it relates to restaurants and bars, you have a 50% capacity. But before you determine whether or not you have 50%, that 50% of what you've been approved for as it relates to fire, you need to first measure and determine how many tables can I have in my establishment where people at one table are at least 6 feet away from people at another table. So when you do that, your capacity may be less than 50% when you account for social distancing, but that is very important. It is also very important that you insist that your customers and patrons are wearing the face mask and practicing social distancing. Now, one thing I want to say about that, when people are sitting at the table, waiting on their food or just talking, they should have a mask on. The mask should only be off if they're actually sitting, eating, dining. Otherwise, they should have a mask. Now, why do I raise those two issues in terms of the mask wearing and the social distancing? Those are two critical things that we look at when we come and inspect your facility and your establishment. Our inspectors will come in and they will look and see, are people wearing the mask? Are people socially distanced? Is there smoking occurring? Because smoking is not allowed. Are people gathered at the bar? Is the bar closed? The bar should be closed. No dancing should be occurring. People should be sitting at a table, ordering food, not chips, not peanuts, but food while they have a drink, alcoholic beverage. I want to say this because we are still enforcing the health directive. And the process for that enforcement is when our investigators come and they see that there are some violations. Initially, they may provide a warning and technical assistance, depending on how blatant the violation is. If it's severe, obvious disregard, we will close on the spot. There has been situations where it's been so blatant, so many people, where the officers, the police and sheriff officers who have accompanied them, had suggested it's too crowded, too much of a crowd to try to shut down now. We will close the establishment the next day. And that's what we do. We will put a placard on there. Now, if that happens to you, if your establishment is closed, the process for getting it reopened is the following. One is that you must submit a reopening plan. And in that reopening plan, you must demonstrate how you are going to adhere to the safety measures outlined in the health directive. That plan is submitted online through our website, through a portal. It is reviewed to make sure that it is in compliance with the health directive. There's a checklist that is used. And then once it is presented to me, I would notify the requester as it relates to the status of the plan. And if it is approved and acceptable, we will send the COVID investigation inspection team out to re-inspect, to confirm that, yes, indeed, you have in place the safety measures that are compliant with the health directive. If the re-inspection is acceptable, then the establishment will be allowed to reopen. Now, this process can take up to 14 days. So I don't want you to think that you can violate today and tomorrow you may be reopened, because when you submit your reopening plan, it goes into the queue. And we have a lot of opening and reopening plans that we have to review. So anticipate that it could take up to 14 days in accordance with the health directive. With that, I'm going to stop and entertain any specific questions that you may have.
Sam Hardiman, Commercial Appeal.
Hi, my first question is for Dr. Haushalter. Dr. Haushalter, you just said that there were 50,994 doses administered, and you mentioned, and this is a housekeeping question before my follow-up, that there are 37,000 people that were vaccinated one time with one dose and 12,000 people that have been vaccinated with two doses. Wouldn't that mean that those 12,000 people with two doses have actually received 25,000 doses of the vaccine or 24,000 doses of the vaccine? Then I have a follow-up.
No, so those two those 12,000, I don't have the numbers in front of me, would have received two, yes. So it's double that number, would have received out of that total 50,000. And then there was the additional that were identified as the single doses. And I apologize, that would not be correct, because it's 12,000, yes, that would be correct. They've received, 12,000 is the second dose, but the other 12,000 is a portion of that 30,000, if that's clear. I think that's where
Okay.
it might seem unclear. The 12,000 is not, that's the number of doses given that was a second dose. So I hope
Okay.
I'm clear. If I'm not, we can offline that by email.
No, that's helpful.
Okay.
So Governor Bill Lee said yesterday that 104,000 doses had been delivered to Shelby County. You're now saying that 50,000 doses have been administered. What's the difference? What happened to those remaining 54,000 doses that haven't shown up as administered yet?
So they're likely being administered currently, and then keep in mind there's always a delay in tennis. So anyone who's administering vaccine on behalf of the state should be entering into tennis within 24 hours. But if there's large volumes, they may have up to 3 days to get that data in. So there's a little bit of a lag time of what's entered into tennis. And then of those 104,000 doses that the governor referenced yesterday, they've gone to a variety of agencies, not just the health department. And so I don't know what those other agencies, where they are in tennis entry, if they're behind at all, and where they are in scheduled appointments. So an example may be we have received Moderna doses that are equal to the first Moderna doses that we gave. We are giving those this week in the first week of February, but we have to keep those doses because they're committed to the individuals who received the first dose. And many healthcare systems are now on the second dose, so they would be in a similar situation, that they have to be able to provide that second dose out of the allotment that they've received. What we do know, though, in talking to all partners, that includes the healthcare systems, obviously the health department, and the pharmacies that we have had conversation with, none of us have either unused or unpromised vaccine. It means whatever we have in our pharmacies now is actually being administered at the moment or is committed to a second dose.
Brad Broders, Local 24.
Thanks, Dr. Haushalter. I know you spoke last night, but since last night, what specific changes were put in motion or already maybe in place today to improve the signage, requiring proof of appointment, checking cards earlier, et cetera, at the Pipkin Building, and what other options could be on the table? And I have a follow-up.
Yeah, so the first thing we did was correct the issue with over appointments, because that's really what led to the big backlog the other day. So we have reached out to reschedule individuals that were beyond our capacity to manage in one day, and many of those have been rescheduled. We also will add an additional day this upcoming week. So typically a Monday that site's not open, we will use Monday to be able to provide the vaccine to those who had an appointment this week but were rescheduled. The signage is in process. It's not necessarily changed yet, but there's signage, and then also clearer communication that an appointment is expected when someone is coming to that site. So one, the signage is in process, as I said, but also we've been saying clearly and assuring those who are checking in on the line that people have to have an appointment to be able to access services at the Pipkin Building.
Thanks. And as a follow-up,
Sure.
I know you mentioned the other day on Tuesday about the expected additional doses starting next week. Do you have any more specifics about the totals of that and that big box retailer element you had mentioned, and also how you envision spreading those extra doses available next week around to these different sites around the county?
So that's a great question. We anticipate getting about 3,000 additional doses allocated to Shelby County. And what we do know, and it's been reiterated at the federal level, is we should have predictability for 3 weeks at a time. So we know for the next 3 weeks we're likely to receive 3,000 additional doses above the 8,900. That'll be divided from the health department as well as the healthcare systems. We are also talking with the state to further divide that now what will be 11,900 to some other community health providers that can help by vaccinating their own patients. More to come on that. And then we do know that the state is in communication with a big box retailer. Our hopes are that that'll be online next week sometime. And as soon as that is up and running, the appointments will be made through the health department, but people will be able to access that retailer in their own community. That does not come out of our $11,900 allocation. The goal with the big box retailer is to have that shipped directly from the CDC. So essentially that becomes bonus doses for us in a matter of 3,000 to 4,000.
Jane Roberts, Daily Memphian.
The Appling Center is not letting people show up an hour before their appointment, so they're limiting it to an hour. Does that seem like it might be a helpful strategy at Pipkin?
Yes, and one of the things that's critical, let me just reinforce the Appling site. So the Appling site has been a testing center for a long time. That's been supported primarily by the city of Memphis, but also through Shelby County. And that's run primarily by University Clinical Health. They can also assign volunteers from their nursing school as well as medical school and pharmacy school. So it's a good operation because they have ready employment and employers employees who are readily available and students who can help. We have to make sure that all of us have the same processes in place. The vaccine for Appling is actually provided by the health department. We have to provide oversight for management of the vaccine particularly. So we had a conversation this morning that included Mayor Strickland, and he did indicate they would go to that 1 hour window, and we've talked about ensuring that we consider that at the other sites that will either be run by the health department or the vaccine provided by the health department. So yes, it's a good strategy.
And do you expect that will happen soon? And then also, can you comment on when the Whitehaven Center will open?
So our goal at the current time for the Whitehaven Center is the week of, I think that's the 5th and 6th. Yeah, so it'll be the following week.
Kelly Roberts, WMC.
Good afternoon. I'm following up about the Pipkin Building and some of the strategies that you guys have put in place to hopefully minimize wait times. The rescheduling, I know that with the extra appointments, there have been well over 800 appointments a day there. How many people do you know that you have rescheduled? Do you know how many, at least appointment-wise, would be going through there today or for the rest of the week?
So one, I don't have the exact number, but we originally were pointing around 800 to 900 appointments per day. Yesterday, we actually did nearly 1,400 at that site. Appling did 1,400, and so with additional staffing, our throughput can be higher. But again, I don't have the exact number of people who were reappointed.
Okay, and just one follow-up. We are still getting some calls from viewers who are going through the process at Pipkin saying that, they're waiting until they're still in line when their appointment time comes, that sort of thing. I know yesterday you said that you guys can't necessarily turn people away, if they don't have proof of an appointment and that sort of thing, even though people have been turned away when it is found out they don't have an appointment or they're there for the wrong dose. Can you walk me through the process? Some viewers say, why aren't people there at Central and early Maxwell, checking or asking these questions right off the bat? Can you walk me through the process of what it looks like when they may be talking to someone on the grounds, if they're asking for an appointment, that sort of thing?
So actually, in getting an appointment, that's done online or through our call-in number at 901-222-SHOT. We are asking people not to show up too early. So I have had people complain that they were in the line for 2 or 3 hours, but I realized they got to the line an hour or two before their appointment. So one, we want to reinforce to people not to get there too early, because they're going to be in a wait line along the way. But when people come to the line, they are asked if they have an appointment, and they are also asked to show that appointment. I think where I probably was not clear, or maybe it was misinterpreted in part because I was responding to a question, is we do turn people away from the line. But if someone has made it all the way through the line, for whatever reason that might be, and they meet a certain criteria, it's about opportunity, and we would give them the vaccine. So an example may be at the Lindenwood site early on. When it was slow, there were some individuals who made it through the line for what, again, there was screening along the way. However they made it through, I'm not sure. But if they were 75 and above, we gave them the vaccine. So the goal is really urging the public to follow the instructions that are given, which is, one, only come to the site if you have an appointment. Only schedule an appointment if you are in one of the phases that's been identified. And right now, again, that's 1A1 and 1A2. That's people 75 and above. And then when you present to the site, to please either bring proof of appointment, or if the individual has an appointment and they have their card from their first shot, they could also show that. Our staff will have ability to check appointments, but really depending on people to bring that information with them. But a person may get into the line, particularly if it's long, and they may actually get to further down the line before they're asked for an appointment and asked to leave. That also clogs up the line. So we're really encouraging people to be respectful to the process and only be there if they have an appointment.
We are out of time. Are there any closing messages today?
I really just want to highlight the importance of our partnership with Southwest. The health department cannot do this alone. We've relied heavily throughout the pandemic on partners, and it's important that we partner with a variety of institutions. We have a long history with Southwest, particularly through their School of Nursing, and so this is just a great opportunity for us to, again, partner with an academic partner, but also serve the community at the same time. And our hopes also that this is a good experience for their employees and for their students. Thank you.
Thanks, everyone.